My name is Erin Aylward, and I'm a graduate clinician at the University of Maine for speech-language pathology. And today I wanted to talk about hearing loss and its effects on childhood development. Just to give a brief couple remarks about hearing loss and what I've found to be very important. I recently went over some client files for my practicum. And I realized that a couple of my clients who are young, between the ages of 3 and 4, so quite young, have not had their hearing evaluated. They're new clients to our clinic, and one of them has problems with articulation, and it's a very unique profile that they're making the glottal sound h in the initial position instead of using their very early sounds of p, d, k, and d. In that case, it would be So this really is my presentation on hearing loss and its effects on childhood development. What is considered hearing loss? Well, children or anybody has a mild hearing loss if their hearing is over 25 decibels but under 40 decibels. If you have a moderate hearing loss, that ranges from 40 decibels to around 60 decibels. And the more severe hearing loss is going to be between 60 decibels, 60 to 70 decibels, and 90 decibels and over. And if you're over 90 decibels, the child is considered to have a profound hearing loss. And these are the children who are considered deaf, and they might need to have cochlear implants or learn sign language, but obviously that is at the discretion of the parents. Here's an illustration of the hearing threshold, and we have something called a speech banana. For people who are unfamiliar with that, it is the area on an audiogram that shows the speech sounds and how many decibels is required for hearing in order to properly hear those sounds. So just as a quick, for instance, the sound at 30 decibels is found on the speech banana. And so a child who has a hearing loss of over 30 decibels is not going to pick up the th sound correctly and could distort their sound. So it's extremely important for a child to undergo hearing screenings during infancy. In fact, I read that many hospitals test a baby's hearing right after they are born. And here is a baby doing a pure tone testing where he has to place blocks into a box whenever he hears the sound coming through the headphones. It's very cost effective in the long run, and it can also help decide what's best for the child before their formative years of language development. Early intervention really is the key to treatment for these children with hearing loss. So what happens during a hearing screening? Well, first we have an otoscope test, and in this step, the clinician looks in the ear to assess the anatomy of the ear and the ear canal. This is the piece that kind of sticks in the ear, and there's a light at the other end. The objective of the otoscope is to locate the eardrum, the tympanic membrane, and assess what the anatomy looks like. So on the left-hand side, I have a picture of a healthy eardrum, which has no occlusion. This eardrum reflects the light from the otoscope. There's no earwax that is blocking the sound from reaching the eardrum. It's just very clean. An excess of earwax buildup can create a conductive hearing loss, which on the right side, we have the full occlusion picture. And this picture would be needing a referral of maybe earwax called cerumen removal. If there is earwax buildup, it can dim the reflected light on the tympanic membrane. And the concern is that the clinician would be unable to see that reflection. An interesting fact is that children who have developmental diagnosis of Down syndrome are known to have very small ear canals or differences in their ear anatomy that affect their ability to hear. Another thing that happens during a hearing screening are otoacoustic emissions testing, or OES. They measure inner ear health, and the way that they do this is they're measuring what is in the inner ear as far as what it's giving back. I'll explain in a second. So it can detect blockage in the ear canal, presence of middle ear fluid, and damage in the cochlea. In order to perform this test, we need to have a quiet room and a very tight seal around the ear, and a probe is placed into the ear. So otoacoustic emissions are sounds given off by the inner ear. The cochlea, which is this spiral picture on the right, is lined with millions of hair cells, which are called cilia, that when stimulated, convert the mechanical energy to electrical impulses that are sent to the brain. This vibration also produces a sound, the otoacoustic emissions, which are barely audible within the middle ear. If hearing loss exceeds 25 to 30 decibels, these vibrations are unable to be felt with the testing probe. So it's another way in the screening to show that a more detailed evaluation is needed. Another thing that happens during a hearing screening are pure tone tests. And this is the test where the headphones are placed on the ears and the child is asked to raise their hand or place a block in a box when they hear the sound. This hearing tests the threshold at 1,000, 2,000, and 4,000 hertz. Normal hearing is between 0 decibels and 25 decibels. And I just have an audiogram on the right-hand side of this slide showing at air conduction and bone conduction what this child could hear. And I have an arrow at 6,000 hertz, which shows at 30 decibels the child was able to hear the sound. So this might signify a mild hearing loss, but definitely nothing really to be concerned about in this audiogram. So how does hearing loss affect childhood development? It causes a delay in speech and language development in regards to receptive and expressive communication skills. If the child is unable to hear speech properly, they'll be acquiring their language from a distorted model. That means that there can be difficulties, like I had earlier described, with articulation because they're not hearing the sounds correctly, or expressive language, what they're able to pick up. This deficit or delay in language acquisition, it can cause learning problems which impact academic achievement. It can also cause communication problems that result in social isolation and poor self-confidence. So there are some pragmatic difficulties associated with hearing loss as well. So let's get specific about the different types of, different areas of hearing loss that can be affected. Semantics, vocabulary development, can develop at a slower pace in hearing impaired children than typically developing peers. Some examples of semantic development are that children with hearing loss will learn the concrete words more easily, like cat, blue, chair, than the abstract words, which are more time-based, spatial-based, feeling-based. And they also have a difficulty with morphology, examples like adding V or R or A. So getting all of that little language pieces that make up our language. The vocabulary gap can also widen with age, so children won't be able to catch up to their peers without significant intervention. They also have a hard time understanding words that have multiple meanings, like bat, which can be a noun, as in a baseball bat, or an adjective, like to bat away something. With sentence structure, children who have a hearing loss also produce shorter and simpler sentences, and they comprehend shorter and simpler sentences. This is because of the distortion. Again, shorter, simpler sentences, it's easier for them to be able to replicate, reproduce, and understand. They also have a difficulty understanding the rules to word endings because of their inability to hear those proper endings, such as ed, like jumped, or s, like dogs, that plurality. So they have misunderstandings of verb tenses, plurals, possessives. And these are all earlier language acquisition components. So without these acquisition components, it is a lot harder for a child to be able to acquire the more advanced developmental acquisition components. So here's the speech banana again, and I just want to point out that with a hearing loss of over 40 decibels, these are the following sounds that a child would not be able to hear. So you can just imagine how distorted their language and their speech could become without the following sounds. B, h, z, v, p, d, k, j, m. And the p, b, d, and k sounds are all some of the earliest acquisition speech sounds that should be acquired around 2 years of age. So children with a hearing loss might not hear their own voices when they speak. They may present in abnormal talking skills, like talking too loud, too soft, too fast, too slow, high pitch, low pitch. They're not able to recalibrate what they're hearing and give it back in that same way. So these qualities can impact the intelligibility of a child for familiar and unfamiliar conversation partners. They may also have atypical stress patterns and poor inflections, which could make their speech harder for people to understand just based on the emphasis that they're putting on syllables. These qualities might also come off as mumbling to listeners, so there's another pragmatic component. As far as pragmatics go, children who have hearing losses can feel isolated. They can feel without friends, unhappy in their school or their social environments, especially if the communication is with other children without hearing loss. And ASHA suggests that these social problems are more prevalent in children who experience a mild to moderate hearing loss than children who present more with a severe hearing loss. So a cause of hearing loss is otitis media. This is probably the most common type, which are ear infections. And children who are young may experience frequent ear infections as their drainage tube, which is called their eustachian tube, moves from a horizontal position to a more vertical position. The tube is also more narrow in young children, which makes them more prone to blockage. Ear infections can cause a conductive hearing loss from fluid that builds up and gets infected behind the tympanic membrane. Usually, the hearing loss is temporary, but in severe cases, the damage might lead to permanent hearing loss. Here's another quiz. According to ASHA, what percent of children will end up developing otitis media or ear infections at least before their 3rd birthday? Is it 90%? 75%, 50%, or 45%? The answer is 75%, the answer B. Almost 1/2 of these children from that 75% will have 3 or more infections before they turn 4 years of age. And this is very important to know because those ear infections can create a conductive hearing loss, which is temporary, but it might not be a temporary thing if if the otitis media continues. PE tubes might need to be inserted into the ears to help with that fluid drainage to make sure that children are not going through all of their language acquisition phase hearing the distorted language from a conductive loss. So it's very important to make sure that if your child is getting frequent ear infections to look into those PE tubes. Other causes of hearing loss are congenital developmental factors, 50% of which are genetic, and the other are prenatal or birthing complications such as being a preemie that can heighten the risk for developing hearing loss. Other acquired non-developmental factors are meningitis, which can permanently cause hearing loss to the point where it can be profound hearing loss. It can be very quick, and the child might need cochlear implants or need to start learning another form of communication such as sign language. Encephalitis, which is the inflammation of the brain, measles, chickenpox, head injuries, and very loud noises, which the very loud noises can damage the cilia, kind of like crunching on the grass. And sometimes the grass will pop up, but if the grass is crunched down too much, it